I'm Wendy Simmons. I'm a physician assistant at Carolina Arthritis Associates in Wilmington, North Carolina. I've been practicing in rheumatology almost 28 years, which puts me around the time of 1997 when biologics were first coming out to be able to treat our patients for psoriatic arthritis. I had been able to see what joint destruction could happen in these patients, what an aggressive disease that can become, which could lead to disability. For this section, I'm going to be talking about a medication review and what is the evidence for Guselkumab efficacy in inhibiting the progression of structural damage. And with this, I like to refer to the APEX trial study data that was recently presented at the 2025 EULAR Congress and Dr. Meath. What we know is that this was a phase 3B study. We know that this is a dual-acting IL-23, which is inhibiting signaling with dual mechanism, one being that P19 subunit, and then that second being the CD64 receptor on IL-23 producing myeloid cells. With this, we have been able to see the data with the primary endpoint at week 24 with ACR 20, but also capturing those major secondary endpoints of joint space narrowing, reduction of bone erosion, and clinical treatment, which results in lower rates of radiographic progression in patients compared to placebo. In the study, these patients had active disease. They had 3 or more tender and swollen joints, elevated CRP levels, but also radiographic erosion as well from prior therapy. So I feel that this is really solid evidence to show the inhibition of progression of structural damage in this trial. The other point here is the frequency of dosing at both Q4 and Q8 weeks, demonstrating the significant inhibition as well. If you would like to have any further information, take a deeper dive, I would encourage you to go to the RAT website for any further data and information. Thank you so much.